This is the Vectra Genisys 4C model. It's an E-stem and ultrasound treatment unit. This is how you use it from the beginning. Once you have it in front of you, you find the electrical cable, which is in one of these drawers. Plug in the electrical outlet and plug it back to the unit. Once you've done that, then turn on this switch, the black switch on the top back part of the machine. Once the machine is on, the screen is coming up with the name of the group that sells it, the trade brand, and then you're going to have different dialogues coming up on the screen. Under the screen you have three buttons. You have a folder, you have a back arrow, and you have a home. What you're going to do, you're going to press the home button. Once you press the home button, that's actually the home dialog with all these different folders which have buttons on the side. The next thing is to do, we have to pull out the ultrasound transducer and the ultrasound head. You get the ultrasound head and place it on its holder on the right side of the machine. Then pull off the front cover of the machine and plug in the ultrasound head. It has three plugs for the ultrasound. We're going to use the top right, and you have to press it so it's sitting nicely to establish contact. Once you do that, then on the screen you can choose what kind of therapy you want to do: electric therapy, ultrasound, EMG, or combination of those. We're going to do ultrasound, and you press the button beside the ultrasound. It's going to show up reading protocol, and then you're going to have two dialogues up here and then one on the bottom. The top right is going to say sound head recommendation. You want to go back, you press the back arrow. Also there's on the left corner you have the parameter rationale. Press that to get information. You can read that, and there's more information when you're pressing next page, and again next page, and that tells you all about the protocol you're gonna do. To go back, you just press the back arrow button. Press the ultrasound. This is the timing. We can edit the time. On the big dial, we set up the strength of the ultrasound. We're gonna do 1 wave per square centimeter, 1.0 waves per centimeter squared, and press the start button. Once the start button is on, the ultrasound is working, and you're going to see a green light on the ultrasound head. This one was automatically set up on 7 minutes. You can edit the time by pressing the edit on the side, and then you're going to see a treatment time dialog. You press the button beside it, and then with the arrows up and down you set up the exact time. Since this is in process, we can't do it now, but usually before you start you do that. We're going to stop the therapy right now, but you can also just set it up for 1 minute to see what kind of warning signals you get once the therapy stops. We stopped it, and we had that little green screen. That means the therapy is over. We could have also paused it. You can just pause it and then come back to it and press start again, and then do the therapy to finish the therapy to the setup time. Alright, that's it. Thanks. Okay, since we got the basic with turning on and off of Vectra Genisys, we're going to do a couple of options. We select the folder. It's the middle button below the screen. Press the folder. The next we press the clinical protocols. Once you press the clinical protocols, you're going to see a body showing up, and it's going to have little dialogues on the side: shoulder, thoracic, wrist, hand, knee, ankle, foot, hip, elbow, lumbar, and cervical. We can choose whichever we want to. For our purposes, we can choose, let's say, cervical, and then we choose acute pain, increase local circulation, or we want to increase local circulation. Are we dealing with chronic pain, or we try to relax the muscle spasm? That's for ES, electrical stem. Or if it's ultrasound, it has 3 dialogues. Chronic pain again, if you want to address scar tissue, or subchronic pain. Since we're doing E-stem, we're going to do, let's say, acute pain. And then is asking you, is it 4 electrodes or 2 electrodes? We can choose 2 electrodes, and it's going to automatically choose the time. It's 20 minutes. Again, you can edit the time by pressing the edit button beside it, and then treatment time. This time we're not going to edit the time, I just want to show it to you. Then you adjust the strength, ask the patient for the input. If they feel it is too strong or weak, and you can make it stronger or weaker. We're going to go to 1 milliampere, and then just press the start button. As soon as you press the start button, you're going to see the timer counting the time down. Once the time is over, you're going to get that sound, and also the screen is going to be green. For our purposes, we're not going to let it run 20 minutes, we're just going to press the stop button. When you press the stop button, it's asking you on the left side, save to patient card. The patient cards, they go in this slot if you have a patient card, and you can save the information about the treatment on that card, and you can just reuse it next time. Or it's going to ask you on the right corner, start new treatment. If you want to start new treatment, you press that, and then you go back again to a new patient. If you want to go all the way back, you just press the home button. When you're done, you press the black button on the back part and turn off the Vectra Genisys machine. With the Vectra Genisys, we can store patient information into the machine itself. You press the folder button, and it's going to show us 4 dialogues: the clinical protocols of the check before, the sequencing, MMC graphical library, where there's a lot of information about the machine and how to use it, or user protocols. Those are protocols that we set up and stored in the machine for our clients. We press the user protocol. I'm getting a little warning, it says no user protocols. If we had one, it would show the protocol, and then the next thing we would go to setting up